Hello, my name is James Hunter, and this is my 2 Cents channel where I talk about topics from physical fitness, mental health, wellness, and just topics I may want to discuss. And today I'm going to talk about what can be sometimes controversial as far as whether addiction, drug use, substance use disorders, alcohol use disorders, and so on. Basically, just using the common term, being a drug addict, is that a disease or it's not a disease, or how is it like other diseases? Are they one and the same? Can you just lump drug addiction into just a broad brush into the category of it being a disease? We're also going to talk about the issues of choice, how much of becoming a drug addict, someone who has, the old term's alcoholic. Now it's called it used to be in the old DSM-4, alcohol abuse and alcohol dependence. Those terms are not used anymore. The DSM-5, Diagnostic Statistic Manual, mental mental disorders, if you will, basically used the terms alcohol use disorder or substance use disorders, such as opioid use disorder. You get the idea. And so it's kind of like on a continuum, if you will, or a spectrum of behaviors, a criteria of an individual who has these issues with abuse and substances. And I'm going to talk about tolerance and withdrawal and the physiological aspects as well. But let's kind of get down to the nitty gritty. Is, addiction, drug addicts, street language, you hear people call it meth heads, crack heads, drunks, and so on. Just to, put it out there, let's be honest. People have a way in how they can view individuals caught up in addiction. And sometimes the language isn't always nice, but it's what it is. The average person does not say, hey, that person has an alcohol use disorder. They'll just say that person's a drunk. Or someone, who's addicted to opiates or opioids. They'll say they're a heroin addict, methamphetamines, amphetamines. They'll say, he's a meth head or she's a meth head. So this type of, you can call it a stigma, stereotype. If someone has cancer, they don't get, alternative slang terms for being a cancer patient or someone suffering from the disease of cancer. They're referred to as someone who has maybe a type of cancer, multiple myeloma, leukemia, for example, pancreatic cancer, and it doesn't go beyond that. It's pretty much dealing with the disease itself. So let's talk about topic number one. I'm going to get into the whole choice issue here later on in the video, but let's talk about what is said about substance use disorders. Okay, as far as we're going to get into how it's like a disease, or how do we differentiate from how it's not like other diseases? Is it one and the same? Okay, so the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, the DSM-5, American Psychiatric Association. So let's not just go by on opinion, right? What I think. Let's see what the experts say. What does the authority, if you will, say? So substance use disorders, the essential feature of a substance use disorder is a cluster of cognitive, behavioral, and physiological symptoms indicating that the individual continues using the substance despite significant substance-related problems, okay? And this is very key. They continue to use a substance despite significant related problems to using the substance. A very important word that's used in here as well is it says that substance use disorders, addiction to drugs, is a cluster, okay? The word cluster, it's more than one thing. Drug addiction, substance use, it's a mixed bag, in other words. So it's cognitive, a way of thinking. I'm going to talk about that in a bit. Our internal experience, if you will, how we view ourselves in relationships to the world, people, places, and things. Attitudes, beliefs, sometimes faulty or distorted type of ways of believing or thinking. And behavioral, okay? So behavior is a huge part of meeting the criteria to have a substance use disorder, and part of the being an addict or someone who's a drug addict, if you will. And physiological symptoms. Notice The physiological aspect is listed as number 3 in how they're describing the situation. So if it's purely just a medical problem, if being a drug addict is because you have a disease, then you would simply just, prescribe someone medication, treat the physiological aspects of it, and then you're done. You're recovered, right? Just like someone who is prescribed medication for any other number of type of physical ailments or symptoms, and then it's resolved, and you're good to go. You don't have to, necessarily continue to work a program of recovery, which I'm going to talk about that, okay, as far as people who are in recovery from drug addiction. So those 3 things, per the DSM-5, the authority, constitutes substance use disorders, or what drug addicts are, what you're dealing with if you're trying to work with someone with this condition to help provide treatment. It's, cognitive, behavioral, and physiological symptoms. You're not simply just going to treat, if you will, the physical aspects. You're looking at a multitude of behaviors and things that got to be dealt with, okay? So when we look at other diseases, we're going to talk about, the difference here. Before I get into that, though, I want to go ahead and talk about the extreme ends of this debate or argument. And I'm not making this video to be antagonistic, just for the record. I want to have an honest conversation where people can, not have to worry about, in this day and age, people are worried about political correctness. And language is a part of political correctness. Let's be honest, it's about controlling. When you control a conversation and you control how you can have a conversation about any number of issues, it's about an agenda. It's about control, power, if you will. Special interests sometimes may have a reason for wanting to use certain types of languages, and I'm going to get into that. So when we look at diseases, I've worked as a counselor, licensed counselor, for more than 20 years. I've worked with mental health, substance abuse rehabilitation, and as far as level of care, I've worked with inpatient and outpatient and so on. I've seen people go through detox, supported residential programs, and so on. So you have people, just because we're all counselors doesn't mean we all think alike. It's farthest thing from the truth. I know people who've worked in this field as long as I have, who 100% believe, over here on one side, it is 100% a disease. You're born with it. There's nothing you can do about it. And it had nothing to do with your choices or your behaviors. It's just like if you were born with any other number of conditions, like someone born with cerebral palsy, somebody born with diabetes type 1, someone who develops cancer, if you will, right? It's the same thing to them. So they don't necessarily feel that it's appropriate to use the moral model, if you will, in terms of a person's character, looking at behaviors, decisions, and choices that were part of a process that led to becoming a drug addict, right? Now, I'm going to talk about the process of how a person can become an addict. And within that process, there is situations in which there is an element of choices. And there's also a progression of addiction when it's in the harmful dependent state, where choice may not be as much of an option anymore once it gets to a certain level of harmful addiction. I'm going to talk about that and being able to distinguish that. So you have people on that end. And then you have people that are counselors who work in the industry who are all the way on the other end. If you will, you can say they have more of a conservative outlook. You can use whatever label you want. They will say it's not a disease. Becoming a drug addict is 100%. It's all about your choices and the decisions you made in your life that basically developed into now you're a drug addict. It's not so much a physiological problem, more so than it is an issue of your character, it's moral behavior, and so on. And that, it's because of your decisions. That's why you became a drug addict. It is about choices and decisions. So my experience is that the truth is usually somewhere, it's in the middle. And the reason I say that is because even on the extreme end of arguments, they have some valid points. It's not that they're totally wrong, but sometimes when you have an extreme view on one end or the other, each end or whichever side of the argument you're on, if it's too extreme, there's something lost in that can be lost in terms of people trying to get treatment to be in recovery, and how do they address the more comprehensive view of recovery and treatment for drug addiction. So if you're on the extreme end, that it's 100% a disease, has nothing to do with choices, and we don't need to be judging people, and so on and so on, there's something lost in that because there's no ownership of a person's behavior. And if there's no ownership of your behavior, that is detrimental to recovery. Because while there is an element for some individuals where they may have had a temporary period of time of powerlessness over their, as far as their addiction is concerned, once they become medically stable and they're receiving treatment and so on, recovery is 100% about empowerment. And part of that empowerment is taking responsibility for your behaviors and decisions, learning different ways of coping and so on. So this is going to lead right into how is becoming a drug addict, the addiction, how it's not like other diseases. In all honesty, no, it's not. And here's the difference. We're going to talk about a 12-step program. A lot of you may be familiar with the 12 steps. And I'm going to go ahead and actually pull those up right here, the 12 steps. And here we go. So the 12 steps, here's one for the Alcoholics Anonymous. But these steps right here are the same for Narcotics Anonymous, NA. I mean, there's even Cocaine Anonymous just for cocaine users. And then, people may have other addictive type behaviors where they use these 12 steps. So the 12 steps deals with issues of, step number 4 right here is an individual makes a searching and fearless moral inventory of themselves. Number 5, they admit to God, to themselves, and to another human being the exact nature of their wrongs. Number 6, they're entirely ready to have God remove all these defects of character. 7, they humbly ask him or her, or whatever their higher power is, to remove their shortcomings. And number 8, they make a list of all the persons they've harmed, and they become willing to make amends to them all. And so on and so on. And I'll go more over these a little bit more. So here's some words right here that, depending on what end of the spectrum you're on, don't you dare bring in morality. Don't you dare make a judgment about a person's character, right? So those types of things can be controversial words. You don't go there, right? That's politically incorrect because addiction, it's a disease and it's not their fault. Well, objectively speaking, character just deals with characteristics. And being able to break that down and assess our characteristics, objectively speaking, isn't necessarily a moral condemnation, if you will, against a person from that standpoint. Number 4, making a moral inventory. You can Google the word moral, look it up in a dictionary. Essentially, simply put, it's looking at right and wrong type behaviors, or a right way of living versus a wrong way of living. And if you want to make it even more simple, maybe look at it as behavior that is either harms other people or violates the rights of other people, or it doesn't. And you can look at that from different angles. But the word moral is used in the 12 steps. So the 12-step program, in pretty much every place I've worked, it's pretty much promoted and used, and it's encouraged for drug addicts to work the 12 steps in recovery. Judges in the court system, have you been going to your meetings? Have you found a sponsor, right, for people that are on probation? So where am I going with this? Well, here's the difference. There's a reason, drug addicts, people in recovery, are asked and encouraged to work the 12-step program. Because just like I mentioned in the DSM-5, and I read it verbatim, you're dealing with cognitive, a way of thinking, and behavior. Because behavior is huge. You got to look at changing your patterns of thinking, behavior, character, a person's character, and defects of character. It has to do with behavior. So a person who goes to MD Anderson for treatment for cancer, or any other medical facility that deals with the treatment of cancer, someone of diabetes type 1, an individual who gets Alzheimer's dementia later in life, somebody born with cerebral palsy. Pick a number of medical conditions that can be progressive and developmental in nature. Cancer, let's use the cancer example. My mother had cancer, by the way, and that's what she passed away as a result of that. So cancer patients, when they're at MD Anderson or their doctor that's treating them, the doctor doesn't tell them, hey, I strongly recommend that you go to Cancer Anonymous and you need to work a 12-step program and you need to make a fearless moral inventory of yourself and you need to work about, looking at your defects of character, and you need to correct those things. You need to change the way you live your life. You need to make amends to people, right? That doesn't happen. You don't see a cancer patient being told by their doctor they need to work a 12-step program. The reason is because that's purely, it's a medical problem. The cancer patient didn't, do things in terms of their decision making per se to get leukemia, pancreatic cancer, multiple myeloma, and so on. So there's not a correction in terms of behavior and a way of thinking necessarily that's going to be necessary as an important part of their recovery, right? Now they may need to make some lifestyle changes, eat healthier, start exercising, those types of things. But these are more practical interventions dealing with physiological health, and yeah, it helps mental health too as well. But you're not looking, the cancer patient is not making a list of people they need to make amends to, right, that they've harmed. Same thing with a person with getting treatment for diabetes. They're not told to go to Diabetes Anonymous and work a 12-step program and so on, and work on removing their defects in character. So that's the distinguishing difference. Because the truth is, whether we like it or not, people who are caught up in drug addiction and their active addiction have behaviors that do cause harm. They can steal from people, physically aggressive behaviors, committing crimes. It's not a pretty situation, and it's not an accident or coincidence necessarily that people caught up and addicted to drugs end up in the legal system, for breaking the law. They continue in behaviors despite negative consequences to their life, and that is really the key distinguishing thing with a drug addict, is despite negative consequences to their physical health, their mental health, inability to keep a job, legal consequences, the deterioration of their life, if you will, they continue to use the drugs, and that is the distinguishing factor of a drug addict or someone caught up in addiction. This issue of physiological symptoms such as tolerance and withdrawal, someone who's addicted to opioids, they're going to have some unpleasant symptoms, diarrhea, bone chills, bone aches as they withdraw off of opiates. So that in and of itself, if that's all they have as a physiological symptom, they're not a drug addict, nor do they have a substance use disorder. A person can go into a hospital for a surgery, knee surgery, back surgery, and be prescribed temporarily opioids like hydrocodone, oxycontin, morphine, and pick an opiate or opioid for pain management, if you will. And when they come off of it, they go through a process of withdrawal, and they'll notice that. They'll have some withdrawal symptoms. If they go through that and they move forward and they don't use drugs again, then just because they had tolerance, physical dependence, and withdrawal, that in and of itself doesn't constitute a diagnosis for them having a substance use disorder or being an addict. They just had that physiological symptom. So the distinguishing thing that makes a person a drug addict are the behaviors. The behaviors associated with if they have tolerance and withdrawal and acute withdrawal symptoms that are unpleasant, plus the behavioral problems, breaking the law, stealing, inability to maintain relationships, dysfunctional relationships. Their life is just totally unraveling. Despite these negative consequences, they continue to use drugs. That's the difference right there. So how it's like a disease, here's how you can view drug addiction like a disease. It is progressive and developmental in nature, meaning that if you don't get treatment for it, it can be progressive and get worse over time, and it can kill you. So that's how it can be, use that analogy like it's a disease. Are there predisposing factors? The biomedical model or psychosocial model, it's really a combination of both situations. So where I'm going at with this video is that the medical model or look at hereditary genetics and things like that, as far as if you're born with something, you can be predisposed to have a more vulnerability or be at a higher risk for becoming a drug addict once you start using drugs, in terms of how that can escalate more quickly for someone whose parents were addicted, whether it was alcohol, opiates, stimulants like methamphetamines, and so on. So that risk factor is there, just like someone may have a higher risk factor for diabetes type 2 if it runs in their family. The difference is this, is that Genes are like bullets in a gun. You can load a gun of bullets, and those are like the genes, but something still has to pull the trigger. Something has to pull the trigger for the bullet to fire. So just because your parents, have a history of a drug addiction, that's no guarantee or an absolute that you yourself have to become a drug addict. It's not the case. Something has to happen. Number one, you have to take the drug to begin with. Two, stress from the environment has to occur, usually for a gene to be expressed. So I know that there's a lot of people that, unfortunately, as a child, where they weren't able to make good decisions, they're dependent on their parents and things like that. There are unfortunate situations where a lot of people, they got introduced to using drugs as a child by their parents. So I understand the argument, from that standpoint. How much of a choice did a small child have in making a good decision if their parents are the ones giving them the drugs? So from that standpoint, that's a different situation. It's unfortunate. And I have seen these individuals, once they got older and they became more educated and they learned about addiction, they were able to break the chains of addiction and still, get into recovery. So as challenging and difficult as it can be with these generational patterns, recovery is still possible. So when we look at these 12 steps, these 12-step programs, are encouraged because there is an issue that's got to be dealt with, changing the way you live your life. To be in recovery, a lot of these individuals, they've heard a lot of the information about, education, about how, harmful drugs are, and they've been educated. The problem is not education in and of itself, because that was the case, you just provide education and everybody would stop using drugs. The problem or the challenge is creating a new life, new relationships with people, new ways of coping with stress, a new way of thinking, your internal coping mechanisms. How do you relate to the world, people, places, and things in regards to yourself? Do you have distortions, thinking errors, things you need to change in order to be able to make have healthier ways of dealing with the world, alternative coping skills, if you will, instead of having a unhealthy or maladaptive way of trying to adjust to stress, which is basically to cope with it by using drugs, which a lot of individuals do. So you have to learn a new way to manage stress, new relationships, having boundaries. You have to cut off the old relationships with people that still use drugs. That's just what it is. So if you don't create a new life, put your energy into creating a new life, and sometimes that can be changing to a new job for some people. You can have the strategy, I'll just move to another town, or I'll just move to a different neighborhood. But as the saying goes, wherever you go, there you are. So you got to be the one that changes within you. You have to change yourself. So you have the coping skills necessary to be successful regardless of what town you live in and so on. So these are some of the thoughts on this discussion. How much is addiction like a disease? Is it exactly like it? Is it the same thing as cancer? Are they in the same category? Diabetes. So I respectfully say no, they're not, because as I mentioned earlier, the oncologist or the doctor treating a cancer patient doesn't, prescribe or put on the treatment plan that they need to work a 12-step program. Unless they also have a co-occurring situation with substance use, and then that would make sense. But if a person just has cancer, then no, the doctor's not telling them to go, they need to work the 12-step program and do that moral inventory and work on removing character defects. Same thing with any other disease. So that is a distinguishing factor. So if you're a counselor out there watching this video, and sometimes you get stumped when there's these discussions are going on, maybe at a training at work or something, ask the question to those people that are on the extreme end, right? It's all a disease, and it's not about choices. And you can't, be passing judgment on people, and they kind of get into that arena to try to distract from a conversation. Politely ask them, well, wait a minute. If it's like all other diseases, how come the cancer patient isn't told by their doctor they need to work a 12-step program? Ask them that, right? I'd be interested in what their response is, if it's exactly like all other diseases. So you can also go back to the DSM-5 It mentions cognitive and behavioral uh, situations before it even mentions the physiological aspects of it. So, what are your thoughts on this? If you're someone in recovery yourself, maybe you're thinking about getting treatment. You're thinking to yourself, well, how much is this about me making choices, right? Versus, is this a disease and it's not my fault, right? What do you think? What are your comments? I'd be interested to hear from you below. I think the issue about the whole choice creates a lot of it's a hot button issue in this industry and field when we talk about addiction, the whole choice issue. So we talk about being politically correct. I know people in recovery that will use the term drug of choice, and they're okay with saying that. But apparently, you're not supposed to say drug of choice anymore because that indicates they have a choice in it, right? So don't say drug of choice because they have no choice; they can't help it, right? So I have always said, there definitely can be a drug of preference. If you give a heroin addict, someone addicted to opiates, $100 bill, chances are they're probably going to go buy, five $20 papers or $100 worth of heroin and use that before they're going to go buy a case of beer, right? So sometimes political correctness can get a bit too ridiculous where, you can't even have a conversation anymore. So the whole issue with the choice process and so on is that yes, people can be born with a higher risk factor, a greater vulnerability, if you will, to become a drug addict and have their life become unmanageable and become, for a period of time, powerless over a particular drug that is dominating their life. But there is a choice involved in terms of decisions and how that process begins. They had to start using the drug to begin with that didn't get in their body by itself. So that could be due to not having good coping skills and they succumb to peer pressure. It could start recreationally at a party, right? Their friends say, "Oh, come on, try some, right? Do a line of coke. Here, let's try some meth. You're gonna like it." Or it could start at a job. I know people work in the oil field. They started doing cocaine, and then meth was cheaper, so they started doing methamphetamines, and that's how it became into a full-blown addiction, and they became powerless over it and ended up losing everything. So they were taking the stimulants to stay awake. They're working these long hours. So these situations began of choices. They were making a choice to use a drug as a coping mechanism to deal with the stress of needing to stay up for long periods of time, rather than looking at, hey, wait a minute, let me try to make sure I'm getting good sleep, try to take care of myself, looking at other ways of managing the stress. So objectively speaking, yes, there's choices that are being made in that process and how they got caught up in drug addiction. To simply say that it's not a choice is irresponsible, because when you try to help these people in recovery, you're asking them, if you have a complete program, you're going to ask them to make lifestyle changes, to learn new ways to manage stress, right? Well, what are you going to do in the future if you need to work long hours at a job? Well, we know what happens when you use methamphetamine. That doesn't work too well. So what are we going to do differently this time? So we're looking at changing behavior, new ways to manage stress, and so on. How are you going to change the way you think about problems into a healthier way of reframing things that allows you to cope with it and not relapse and use drugs? Relapse is not just physically using drugs, it's emotional, it's also mental. That could be a different video. So becoming a drug addict, regardless of your risk factors in terms of your family history, regardless of your genetics, your hereditary, regardless of how that may be different for everyone, there's always an element, and some part of it is dealing with choices, right? Even if you started as a child and it wasn't your fault, I've seen that happen. The parent makes them do the drugs. That's pretty sick, but it happens. So in that scenario, that person didn't have a choice, but later in life, they made a choice to accept help to get into recovery. So at some part of that process, somewhere in there can be some choice. And I say that not to be antagonistic. I say that to encourage someone. If you're watching this video and you think your situation's hopeless, it's not. You have a choice somewhere. If even for today, it's to call a treatment facility to get on a list to get admitted for treatment, right? So these are some of my thoughts on this in terms of this discussion. So this video is going on, let me see, about 30 minutes, and I don't want it to go on forever because, well, just I'm not sure how much time in the day people have to be watching videos. As far as even if you find the content interesting, I do appreciate it. So I hope I didn't leave anything out. I probably did. I mean, there's so much that could be said. I think that the honest way to discuss things is to look at both ends of an argument. Yeah, I do believe that addiction it has similarities to diseases. Absolutely, it does. It's progressive. It's developmental in nature. It requires medical intervention and treatment. Some people cannot, once they're caught up in active addiction, especially with alcohol. I'm glad I remembered to mention the alcohol. Alcohol is the most dangerous drug to detox or to stop cold turkey if you have the severe physiological dependence and addiction, if you will, meaning that the acute withdrawal symptoms can include seizures, grand mal seizure, which is the worst type of seizure that can kill you, DTs, delirium tremors, and very unpleasant situation. You can die from stopping alcohol cold turkey without medical supervision to have that supervised with medication and to taper off till you're medically stable. Once you're medically stable, though, moving forward, it is about choices and decisions. You got to decide to live your life differently, and you're not, powerless at that point. So they do need medical intervention for those who have that level of severity and addiction to alcohol. So with heroin, opiates, the acute withdrawal, yeah, it's very uncomfortable. These individuals deal with diarrhea, bone aches, severe sweats, very unpleasant symptoms, vomiting. It's bad. I've seen it. And for these individuals, if you're a guy and you get locked up in jail, you're going to have to kick it in jail. You're just going to go through all that. Pregnant women, if they're in prison, then they'll allow them to do methadone, something to that effect because of the unborn baby, and so on. So yeah, there's medical intervention, in other words, that is required for a lot of individuals to get them stabilized. But once you're medically stable and you're getting help and there's resources out there, I don't care what anybody says, if you want it bad enough, there's state-funded treatment programs, there's federal grants through SAMHSA, and so on. You can get help if you don't give up and if you're motivated and determined. Once you're medically stable, you don't got no excuses if you want recovery bad enough. You start working on how you cope with stress, how you think, changing the way you live your life, how you maintain or manage relationships, and so on. Is it easy? No. It takes work, but if you want it, you can do it, and it is a process. And a lot of things in life are not easy. I mean, how many things in life are easy? It takes an effort in a lot of areas of our life. So recovery is worth it. Your worst day in recovery while being abstinent from drugs and alcohol will always be better than your best day caught up in drug addiction for those people who've been on the streets and have lost everything. So I hope this video was helpful. If I left something out, please drop it in the comments below. I'll be making some more videos on this topic about the whole choice issue and predisposing risk factors, and also the issue of, can we have a conversation about moral behavior, character defects when we look at people who are using the term drug addict, because that's what's used a lot in society. I guess the PC word in treatment it would be someone who has an alcohol use disorder or substance use disorder, right? So you can use the clinical terms if you want. If you want to be use language, it's more neutral. That may not offend somebody. There's a lot of other stigmatizing language, crackhead, meth head, drunk, and so on. So yeah, are we allowed to go there when we talk about people's behavior? If we're not, then I think there's something lost in recovery, because ownership of one's behavior is an essential part of recovery. We got to look at that. We got to own it. You got to change it. And if we don't, if we feel we don't have to own that, as far as this extreme end, it's none of it's your fault, then abstinence from drugs alone is not recovery if we don't work on changing the behavior aspects and the way we think and live our life. So until I make another video, I hope you'll have a good day and take care. Thank you. Oh, and also, please like the video if you found it helpful and subscribe to my channel. I appreciate the support. Thanks.